Hello and welcome back to Human Parasitology. We're now ready to talk about the tapeworms that are known as the Cyclophyllidia. The members of this group are rather varied in appearance and in the adult stage as well as in the larval stage. And this first slide just kind of emphasizes that fact. So here you can see an entire tapeworm, and this is the smallest of the Cyclophyllidean tapeworms, and really just consists of these three segments and the scolex. Here you can see different types of larval stages, which we'll be talking about a bit later. Here, here, and here. And here you can see the close-up of a armed scolex, a scolex that has acetabula, the suckers that are prominently shown, the rostellum with hooks. So the members of this group have some shared characteristics. The first is a scolex with acetabula. Again, the term acetabula refers to the suckers that are associated with the scolex. The rostellum, which is the prominent sort of extension of the scolex, can be present or not present, and it may be armed with hooks or not armed, and that's typically referred to as an armed rostellum if the hooks are present. The members of this group are all monoecious, which means that both male and female reproductive structures are found in the individual worm, and in fact in each individual proglottid. And all but one species in this large group have to have two or more hosts in their life cycle. And in just a bit we'll talk about the one example of a species that has lost the requirement for two hosts. The eggs of these tapeworms are shed into the feces and are typically ingested by an intermediate host in the life cycle. These are predominantly terrestrial life cycles. There is no free-swimming larval stage like we saw with the pseudophyllidean tapeworm, Diphyllidium bothrum, and instead the eggs are typically released in feces and then ingested. After being swallowed, the eggs hatch in the digestive tract of the intermediate host, whatever that host might happen to be, and then the embryo hatches out of the egg. Just like we saw with the pseudophyllidean tapeworms, the cyclophyllidean tapeworms have a hexacanth oncosphere embryo, and remember that this embryo has three sets of paired hooks, and the embryo hatches out of the egg and literally migrates out of the digestive tract and gives rise to whichever larval stage or metacestode is present in that particular life cycle. Here in this slide you can see some of the variable appearances of different eggs. Up in the upper left hand corner you can see Dipyllidium caninum eggs. The Dipyllidium caninum species is a very common tapeworm of dogs, and I venture to say that many of you have seen the proglottids of this tapeworm released by your dog, maybe onto your lap or into the dog's bedding. These eggs are actually packed in a capsule, so each of these inside is an individual egg, and this is a capsule of the eggs, and this is the appearance of the members in this particular genus. Here you can see more clearly in this specimen, this one, and this one, that the hexacanth oncosphere embryo is present in each. And I just pointed out because you can clearly see hooks here. So this is the outer shell of the egg, and this is the inner embryo here, here, and here as well. We'll be talking about each one of these and some of their characteristic properties momentarily. First, I want to talk about the different types of larval stages that are observed in these various Cyclophyllidean tapeworms. These larval stages, again, that are found in intermediate host, are often referred to as bladder worms or metacestodes. We're going to focus on the ones that are present in the species that are most commonly associated with human tapeworm infection. First, we have what's called the cysticercoid stage. And the cysticercoid develops in the hemocoel of an invertebrate intermediate host, such as an insect. This stage forms after the egg stage is swallowed. The embryo hatches. It penetrates the digestive tract of the intermediate host, which in this case is an invertebrate. And then in the cavity that's known as the hemocoel, this cysticercoid develops from the embryo. What you can see is that there's a single protoscolex. So this is the protoscolex, or the structure that's going to give rise to the structure known as the scolex in the adult worm. And here you can see the protoscolex in the actual photographic image. And this protoscolex is invaginated into this sort of fluid-filled cavity. And here you can see the actual photograph. So the way I would describe this is if you imagine that you had a balloon with a maybe the head of a dog or something on top of the balloon, and you put your hand on top of the head of the dog and pushed it down into the balloon, that would kind of give you the idea of what we mean by invaginated. The remaining larval stages that we're going to talk about are found in life cycles of tapeworms that utilize a vertebrate intermediate host. And we first have the cysticercus. So cysticercus is the singular form. Cysticerci is plural. And the cysticercus, there is also a single protoscolex, but it is both invaginated and inverted, which you can see from this line drawing here. So here you can see that the protoscolex is basically upside down or inverted as well as invaginated. And this is the way a cysticercus looks when it's been stained. And here you can see the protoscolex. The size on this is about the size of a medium-sized pearl. And actually they kind of look like pearls when they're present in the muscle tissues of the host. Next we have the larval stage known as the cinereus. So cinereus is singular, cineri is plural. And in this structure, which is similar to the cysticercus, except there are many inverted, invaginated protoscolices. So there's a single structure, a single larva, but the germinal layer inside, you can see here in this diagram, has given rise to multiple protoscolices. And here is an actual photograph. You can see this cinereus with these individual protoscolices that are found within this fluid-filled larval stage. We then have the unilocular hydatid cyst. These can grow to tremendously large size. It's really restricted based on where the cyst is growing. There can be several million protoscolices present. Their protoscolices are inverted and invaginated. And then inside that structure, you can actually have germinal layers giving rise to brood cysts inside. So sort of like a balloon within a balloon within a balloon. And inside each of those internal brood cysts, you can have hundreds or even thousands of protoscolices. When the protoscolices detach from the germinal layer, they fall to the bottom of the hydatid. So if you imagine the hydatid is kind of a big complex balloon, and if you hit the sides of the balloon and knock the protoscolices off, they would fall to the bottom of that cyst and collect there. And that is known as hydatid sand. The multilocular hydatid cyst is also known as the alveolar hydatid. And in this cyst, in addition to having this large larval stage with internal brood cyst, you can also have external brood cysts. So you have extensive exogenous budding in addition to internal budding. And this actually allows this larval stage to be invasive, like a giant cancer. And in fact, these larvae do invade organs over time and are often mistakenly identified as tumors. And then when the surgeon gets into the patient, they realize that they have a very different situation than what they had anticipated. So I have a couple of figures here to show you. So this is a photograph of a hydatid cyst, and this is a normal ruler here. So you can see that this is about 11 or 12 inches long and filled with protoscolices. And here you can see a diagram that sort of depicts what you would find inside this structure. This is a higher magnification view of just a segment of that inner germinal layer. So imagine that we're looking on the inside of just a small region here, and you can see the protoscolices that are budding off that germinal layer. Down here you can see the multilocular cyst, or alveolar as it's also called, and here you can see in addition to all this internal brood sac structure, you get exogenous budding and even metastasis. So sometimes these brood capsules break off and get distributed elsewhere in the body where they develop. So we're going to look first at cestodes in the family Taenidae. These are the largest of the Cyclophyllidean tapeworms. They have a scolex with pronounced acetabula. The eggs have a thick striated shell, and in fact, based on just the morphological appearance of the eggs, you really can't tell different species apart. So you would have to use molecular techniques to tell which species you're dealing with, unless you can get some of the proglottids out of the host to examine. All of the species in this family are apolitic, which means that there is a section of gravid proglottids. Usually it's more than one, not always, but generally there's a section of gravid proglottids that are filled with eggs. The proglottids themselves detach and then pass out of the host with feces. We're going to look first at the pork tapeworm, Taenia solium. This is an interesting parasite that is a parasite that infects humans specifically. So humans are really the only definitive host. And we have a long period of coevolution with this particular parasite. Humans no doubt have carried this parasite for as long as humans and pigs have had a close association. So pigs are the intermediate host and humans are the definitive host. Now, I want to point out in this life cycle, the CDC life cycle is actually showing you the life cycle of Taenia solium and Taenia saginata at the same time, but we're going to cover them separately. So I'll just briefly cover the highlights of the life cycle. So these large tapeworms are found in the small intestine. Generally speaking, there's usually just one very large tapeworm. And you can see that the scolex looks a bit different. So Taenia solium has a scolex with an armed acetabulum. And these worms grow to very long lengths. Gravid proglottids drop out into the environment in the feces. And the eggs are inside these gravid proglottids. And along comes a pig. A pig ingests the human feces containing these proglottids, ingests the eggs. Inside the intestine of the pig, the oncosphere embryo hatches. It actually penetrates the digestive wall and is circulated in the bloodstream into the pig's musculature. So the various muscles, tissues of the pig that are going to later be eaten by a human can be contain these larval stages that develop. So when the oncosphere embryo penetrates the muscle tissue, each oncosphere embryo develops into an individual cysticercus. So you can have hundreds of these cysticerci in muscle tissues of the pig. Pork that has these pearl-like cysticerci present in the meat are referred to as measly pork. And reportedly, pork that has the cysticerci present is actually more tender and sweeter in taste, as described by folks that live in endemic areas. Now the problem comes when people eat this pork undercooked. So if the pork has not been thoroughly cooked and the cysticerci are still viable, when the human eats that pork, these cysticerci are swallowed. Remember, the protoscolex inside each of those cysticerci everts, attaches, and the adult tapeworm develops in the small intestine. Here's a close-up of the armed scolex, so you can see the acetabula, and you can see this rather prominent rostellum with these hooks. On your own, you can view this YouTube video that I provided. So the adult tapeworm is often, the adult tapeworm specifically attaches to the small intestine. Usually there's only one present, and it can be very long, up to 10 feet, if you can imagine that. Humans are the only definitive host. Pigs are the intermediate host. And the adult worm actually has a very small scolex. So if you go back to this picture here, the scolex is only 1 millimeter in diameter. It's quite tiny. It does have these interesting looking rastellar hooks and teniasolium, whereas in the adult stage, it's fairly innocuous. People may not even be aware that they are harboring the tapeworm. It actually turns out that it's the most dangerous tapeworm of humans because of the possibility of acquiring cysticercosis. So the adult worm is acquired when people ingest measly pork containing cysticerci stages, but cysticercosis develops if people accidentally ingest the eggs instead. Now, the clinical symptoms of just having the adult tapeworm, not of having cysticercosis, but having the adult tapeworm, are really fairly mild. You can have some irritation to the mucosal lining. There are very rare cases where the scolex has actually worked its way into the submucosa and have even penetrated or perforated the intestine, but that's extraordinarily rare. So generally, you just have the mild sort of abdominal symptoms of almost any intestinal tapeworm. Now, cysticercosis, on the other hand, is extremely dangerous. Now, the adult tapeworm is diagnosed by simply finding eggs and/or proglottids in the feces, and it is very easily treated with praziquantel. So if you diagnose someone with this tapeworm, you can administer usually just 1 or 2 doses of praziquantel, and they will, the worm will die and be released. Teniasolium infection is common in areas of the world where people raise pork, and especially where pork is eaten raw or undercooked. The cysticerci are clearly visible in the pork tissue, and as I've said, in some endemic areas, it's actually recognized as having a favorable effect on the meat. Not surprisingly, with our standards for meat production and meat sales, there's a very low incidence in the U.S., and the reason for that is because pigs are typically raised well away from human feces. But it is still very common in many parts of the world. Mexico has one of the highest prevalences in the world, and certain regions in Central America it's also still very common. And again, the epidemiology requires that people that harbor the adult worms are defecating in the environment, and that pigs are actually ingesting the feces with those proglottids and eggs. Because of religious dietary rules that forbid pork consumption in Muslim countries, this infection is very rare. The same would be true in Israel because in Jewish faith, the ingestion of pork is forbidden, and that makes this infection quite rare in such cultures. Now on to cysticercosis. So cysticercosis occurs when a human accidentally ingests the eggs of teniasolium instead of ingesting the cysticerci in pork. Where do the eggs come from? The eggs can come from autoinfection. So if a person has the tapeworm and they don't practice good hygiene, they could actually end up ingesting eggs from their own tapeworm, from fecally contaminated hands or food or water. Food handlers that are infected with tapeworms can contaminate food and pass this infection on to others. It turns out that only about a quarter of patients that have cysticercosis also have the adult worm, and what that means is clearly they have acquired that infection from someone else. They don't have the adult worm, but they've been infected by another person that does carry the adult worm. When a person swallows the eggs, the oncosphere embryo hatches, and is picked up in the circulatory system and dispersed throughout the body. The cysticerci form in the human tissues just like it does in the pig. Most often in humans, the cysticerci form in skeletal muscle tissues, but there is also a tendency for the cysticerci to lodge in the CNS and especially in the brain. The cysticerci are small, again about pearl size, so 1/2 to 1 centimeter, and they do become encapsulated by a host leukocyte response. If they're in subcutaneous tissues or muscle tissues, and there's just a few, they don't necessarily cause any major problems. Now, if they're in the brain, of course, that story is quite different. Heavy infections, though, if you have a lot of these larvae, which would mean that you ingested a lot of the eggs, you could have muscle spasms, muscle weakness, general feeling of malaise. The most serious symptoms, however, occur up to a decade or more after the infection has been acquired, because over time, some of these cysticerci die, and the patient has built up a strong immunological response, especially a type 1 hypersensitivity response with IgE, and that reaction can be very severe and even fatal. The cysts that develop in the central nervous system and sense organs like the eye obviously are going to exert mechanical pressure and can cause very severe neurological symptoms. When they're in the brain, they can cause violent headaches, convulsions, seizures, local paralysis, vomiting, optic disturbances. Those are all very common symptoms of cysticercosis of the brain, which is referred to as neurocysticercosis. Here you can see a very severe case. This is a digital image, and you can see there are numerous cysticerci in the brain of this individual. This infection is diagnosed typically by linking symptoms in the patient to a history of residence in an endemic area. So for instance, if you were in the US and you're a physician and you have a patient that's coming in and reporting these neurological symptoms, and you find out they're from an endemic area, you also find out they probably have a high eosinophilia, and if you do an X-ray, MRI, or CT scan, you can actually see these larval stages present. Treatment is tricky. So if the cysticerci are in an accessible region of the body that you can be removed surgically, this is not as easy, obviously, if the cysticerci are in the central nervous system. There are recommendations for treating the patient with praziquantel or albendazole plus corticosteroids. So the fact here is that you don't want to kill these cysticerci and cause a very severe type 1 hypersensitivity or even anaphylactic type response in the patient. So if you give corticosteroids along with the drug treatment, that can help reduce the edema and some of the symptoms, which would be predominantly immunological response to the dying cysticerci. There actually, as we're going to learn, is some dispute about whether cysticercosis should be treated with drugs or not. And especially in endemic areas, it's not very straightforward with regard to the actual recommendations. The CDC definitely recommends treating with antihelminthic drugs like praziquantel or albendazole and corticosteroids, and this can be a life-saving measure. All right, now on to the beef tapeworm, or Taenia saginata. Taenia saginata scolex is not armed, so it's an unarmed scolex, but it does have 4 very prominent acetabula. And here you can see the strobila. So this is on the left-hand side here is the anterior end where the scolex is, and you can see that the width gets greater as you come out here to the gravid end. And in this image here, you can see the striated eggs that I mentioned earlier, so that the eggshell of the Taenia is quite thick, and you do have these striations. And inside, you have the hexacanth embryo. So again, Taenia saginata, Taenia solium, Taenia pisiformis, all the Taenia have basically identical looking eggs morphologically. There are some parasitologists who believe that the Scolex morphology of Taenia saginata is sufficiently different from other Taenids like Taenia solium that it should be in a different genus, but that really hasn't happened in the field, and the textbook actually does use Taenia, and most textbook in the field, even if they temporarily recommended a different genus, have all gone back to Taenia. The morphological and molecular data supports the use of Taenia as the genus. The common name is the beef tapeworm. It is probably the most common large tapeworm that infects humans worldwide. It's pretty much found wherever people raise cattle. And the adult resides in the jejunum of the small intestine, so it has the same basic habitat or niche as Taenia solium. Like Taenia solium, it is apolytic, in which gravid proglottids detach and pass out with feces. When they're passed out in the feces, the cattle or other related ungulates can ingest those eggs that are present in the proglottids. And again, the hexacanthonchosphere embryo penetrates the intestinal wall and is carried by the lymphatic or circulatory system to the muscle tissue predominantly. It can be found in muscle tissue or connective tissue. And like we saw in the pig, these embryos develop in a cysticerci. Humans then are infected by consuming cysticerci in undercooked or raw beef. And in cattle, the muscles of the head and heart are especially heavily infected in a beef cattle that has picked up this infection. In the human, though, after swallowing the cysticerci, the protoscolex evaginates attached to the lumen of the small intestine and develops to maturity. So there is a cosmopolitan distribution. Wherever cattle are raised, this infection can occur. Cattle acquire the infection by grazing in fields where human feces has been deposited. When pastures are flooded by extensive rain, or like when rivers and creeks overflow, they can spread human excrement onto areas where it might not otherwise occur. And in some areas, when cattle roam freely, apparently they'll follow a person into the woods and will eat feces. Infection with the adult tapeworm is usually asymptomatic. Again, there's usually just one large worm. If the individual is malnourished or has other debilitating illnesses, then it might have more of an impact. The reported symptoms, again, are relatively mild and include abdominal discomfort, maybe a loss of appetite, unexplained weight loss, and sometimes, again, you could have diarrhea or intestinal obstruction. Again, this is rare because usually there is just one large worm. Importantly, you do not have the danger of cysticercosis. Taenia saginata victims do not develop cysticercosis. So even if people accidentally ingest the eggs of Taenia saginata, they do not develop cysticercosis. Diagnosis is based on identifying the Taenia eggs in feces, and once again, praziquantel is the drug of choice. Next, we have the smallest Taenia tapeworm, at least in the adult stage, and that is Echinococcus granulosus. The common name of Echinococcus granulosus is the hydatid worm, which refers to the larval stage of this parasite. The adult worm itself consists only of a scolex, an immature proglottid, a mature proglottid, and one gravid proglottid. So this is the parasite that I showed you in the first slide that is quite small. especially in comparison to a 10-foot Taenia solium. The larval stage of Echinococcus granulosus and the intermediate host is called a unilocular hydatid cyst. And the disease in humans, in which humans enter the life cycle as an accidental intermediate host, is known as hydatidosis or cystic echinococcosis. In the life cycle of this parasite, dogs are the definitive host, and almost any canine, wild or domestic, can harbor the adult worm. So the adult worm is in canines, and just about any mammalian prey of a canine can serve as an intermediate host and harbor the hydatid. So canines become infected when they ingest an intermediate host, again, one of a variety of mammals that actually is harboring one or more hydatid cysts. Their natural intermediate hosts become infected when they ingest egg stages from canine feces while grazing. So sheep and cattle and even pigs can be grazing and pick up these egg stages while they are grazing. In the case of an animal like a pig, again, pigs are pretty omnivorous and they would have no hesitation to eat dog feces. So the way the life cycle works is this. You have this very small adult tapeworm in the intestine of the dog. Again, any canid can serve as the definitive host. And actually it causes usually very little harm to the canid. So the tapeworm is present in the small intestine, and it will drop this gravid proglottid. The eggs are inside the proglottid, and these eggs end up in the environment. Along comes a sheep or a goat or a pig and ingest this egg with the oncosphere embryo. And the oncosphere hatches in the intestine, penetrates the intestinal wall, gets caught up in the lymphatics, the circulatory system, and these embryos get distributed into liver, lungs, and elsewhere in the body. And over time, the hydatid cyst grows, enlarges, and can become quite enormous and filled with these protoscolices. Along comes the dog, or the wolf, or the fox, and they eat the sheep, or the goat, or the swine, or more commonly in the domestic cycle, they eat offal that is left over after someone has butchered the sheep, and they swallow these hydatids, the protoscolices, evaginate, attach to the intestine, and then develop into adult worms. Humans, as you can see over here on the right-hand side, become accidental hosts because of their close association with dogs. If they accidentally swallow these eggs will hatch, and the same thing occurs in the human as we described over here in the sheep. So the protoscolices, the embryos, the oncosphere embryo hatches out of the egg and gets picked up. It penetrates the digestive tract, gets picked up in the lymphatics and the circulatory system. It can end up in the brain, in the lungs, in the liver, in the gallbladder, you name it. These cysticerci can form even in bone tissue. It just depends on, I said cysticerci and I meant hydatid. The hydatid cyst can form wherever these embryos end up lodging. Here you can see the geographic distribution of Echinococcus granulosus, and you can see that it's actually found in many parts of the world, including Canada and Alaska. The main epidemiological factors, so where it's most common, actually are in areas where people raise sheep and they use dogs in this endeavor. So just to review some of the features, here is the adult worm. So this is Echinococcus granulosus. Here's the scolex with an armed rostellum, an acetabula. There's an immature proglottid, a mature proglottid, and here's the gravid proglottid. Here you can see protoscolices that would be found within the larval stage, which remember is the large hydatid cyst. So when the dog swallows the hydatid, each one of these protoscolices theoretically can attach and form an adult worm. So in humans, again, in certain parts of the world, these hydatids can grow to enormous sizes, especially if they're in a non-restricted area like the peritoneal cavity. Here you can see this enormous hydatid, because these are the hands of the surgeon here. This is being surgically removed. Here you can see a person that has a hugely distended abdomen because of one of these large hydatid cysts. This is a diagram that just shows the germinal layer inside the hydatid with one brood capsule and protoscolices. And here are individual protoscolices from a hydatid. Clinical features of hydatidosis or cystic echinococcosis are eosinophilia. So eosinophil numbers are greatly elevated, and if you measured it, you would find elevated levels of parasite-specific IgE in the patient's sera. As these cysts grow, they can put pressure on organs and cause organ dysfunction. When these cysts grow inside the liver, there are going to be obvious liver symptoms like abdominal pain, biliary duct obstruction, and other symptoms of liver malfunction. In the lungs, of course, you're going to have chest pain, cough, sometimes coughing up blood, difficulty breathing as these cysts become very large. If these cysts are in the brain, obviously you could have severe neurological disorders. These hydatids do grow slowly. It can take years before they reach a size that's large enough to cause a clinical symptom. However, over all that time, that host is continually being exposed to parasite antigen. And because of the IgE, eosinophil type of immune response, there is a type 1 hypersensitivity reaction that is built up in these individuals, and if these cysts rupture, they can result in anaphylactic shock and rapid death. If they're just leaky and are just kind of releasing fluid and antigen slowly over time, the individual can have extreme eosinophilia, hives, and other signs of type 1 hypersensitivity. So how is this infection diagnosed? Again, remember the humans are carrying the hydatid cyst. So if an individual came in and had reports of various symptoms, you would ask if they're from endemic areas, for instance, where sheep are raised and where this parasite is more endemic. What kind of symptoms are they reporting? If you do an X-ray or a CT scan, you're going to see these hydatids present in the tissues. You can also look for Echinococcus granulosa specific antibodies serologically. There is also a skin test where they take a small amount of antigen, inject it under the skin, and look for an immediate wheal and flare. Here are a couple more images. So this is cerebral hydatidosis. So this is the brain of an individual. This person, obviously, this is an autopsy. So here's the brain, and here is a large hydatid right here next to the brain. And this is a person's skull that's been opened, and you can see this huge hydatid cyst. So what do you do if you have a patient that has one of these cysts? You have to remove the cyst surgically, and you have to do so very carefully. What typically is done is the cyst is drained as much as possible and then injected with formalin. The idea here is that by injecting formalin, you're going to kill the protoscolices that are inside the cyst, so that when you remove it, if you happen to nick the cyst, you won't release protoscolices into the patient's body. You also administer albendazole and anti-inflammatory drugs like corticosteroids because you're trying to suppress that type 1 hypersensitivity reaction, because the patient can easily die of anaphylactic shock during the surgery if they are exposed to large amounts of that parasite antigen. If they have small hydatids that are not accessible to surgery, you can remove the large ones and then give them albendazole and anti-inflammatory drugs to try to manage the other smaller cyst. The CDC actually recommends that albendazole treatment and corticosteroids be given prior to surgery. And then, of course, as a precautionary measure, it's very important for people in endemic areas to avoid infected canines, or more importantly, if they have dogs, to keep those dogs treated with antihelminthic drugs. From an epidemiological point of view, there is actually two different pictures. There we have the sylvatic cycle of Echinococcus granulosus. So this would occur with the wild canines and their prey. So if you think about wolf and moose, or dingoes and wallabies in Australia, or coyotes and rabbits in the west and southeast, wolves and reindeer. So the sylvatic cycle is always present. And humans are seldomly involved in this cycle, unless, of course, you have a hunter and a hunting dog that could enter this picture. The domestic cycle of echinococcosis is well known and typically involves, as I mentioned earlier, sheep and sheep herders. So domestic herbivores like sheep and goats raised in association with dogs, and the cultural habit of butchering the sheep and goats and feeding the dog the organs, the offal as it's called, that can contain hydatid cyst. That's how the dogs get infected. And then, of course, humans become infected when they accidentally ingest the eggs by handling a dog, by being around the dog, and being around dog feces. Historically, there are several high-risk populations. Primitive tribes in Kenya are known to have the highest infection rates in the world, and especially in the past. And the reason for this is because of a custom in some of these tribes of eating dog intestine. And basically the dog intestine would be removed and sort of quickly rinsed out, stuck on a stick, and just lightly roasted over a fire. And if the tapeworms are inside the intestines, sort of, and the eggs are still present, they can get a very, very huge dose of those Echinococcus granulosus eggs when they eat the dog intestine. In some cultures, dogs are actually encouraged to clean up children by coming and licking up their faces, or even their bottoms after the kids defecate. And so this activity obviously could lead the dog to transmit the eggs to the child. So if the dog is licking themselves and then licking the child, then the eggs can be transferred that way. And there's an interesting story where there were very high rates of hydatidosis in Lebanon, especially among tanners, individuals who tanned leather. And the reason for that is because they used dog feces in their tanning solution. So they would collect dog feces off the street, and just from handling the dog feces and getting it on their hands and so forth, they ended up accidentally ingesting large quantities of eggs and developing hydatidosis. A related species is Echinococcus multilocularis. It's similar to Echinococcus granulosus, except there is a broader definitive host range, so it can infect dogs, cats, foxes, and other carnivores. Rodents are the most common intermediate host in this life cycle, and the larval stage is the multilocular hydatid cyst. So just to remind you, these large cysts contain exogenously budding brood sacs as well as endogenously budding brood sacs. And these cysts grow like tumors. They grow into tissues, they're invasive, and these brood sacs can metastasize and spread through other areas of the body. They can be extremely dangerous if they develop inside of a human. So the life cycle works like this. Dogs, foxes, cats, and other carnivores are infected when they ingest a rodent that contains these multilocular cysts. And then the inside the dog, the adult worm will develop in their intestine. In the intermediate host, including accidental infection by humans, these large multilocular cysts develop. From an epidemiological point of view, the disease is called multilocular hydatidosis instead of alveolar. And these terms are pretty interchangeable. The infection with Echinococcus multilocularis is less common in humans because it's almost exclusively a sylvatic cycle. It is much more common in northern climates, so-called boreal habitats, like northern Asia, northern North America. The human factor comes into play, especially with hunters and trappers. So people who trap foxes, own sled dogs, are going to be at the highest risk of infection. And again, humans become infected by exposure to eggs from fox feces, dog feces, and so forth. Just like with Echinococcus granulosus and hydatidosis, the treatment is very similar, in fact identical. So it requires very careful surgical removal of a cyst, draining the cyst, injecting with formalin prior to surgical removal, albendazole treatment prior to surgery, as well as anti-inflammatory drugs is the CDC recommendation. And unfortunately, however, albendazole is not 100% effective. This is a very, very difficult disease to treat in humans because even if you surgically remove a large multilocular cyst, there could be other brood cysts in other areas of the body, and albendazole may not necessarily kill all those cysts. So it actually is very similar to cancer in a lot of ways. We will pause and continue in the next lecture with tapeworms that utilize invertebrate hosts in their life cycle.